My name is Joel, and I live with bipolar disorder. Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart, the center cannot hold. Mere anarchy is loosed upon the world. The blood-dimmed tide is loosed, and everywhere the ceremony of innocence is drowned. Yeats's poem, The Second Coming, is about the apocalypse, but I find it describes very well the feelings that I go through when I'm in a mixed state. A mixed state is when you feel depression and mania in such rapid succession that it feels like you have them at the same time. I call them black manias, or depressions with the energy of a mania. They spawn suicidal thoughts, which are like the penny in the garbage disposal, rattling around, making a lot of noise, with the potential of stopping it all. There are many ways to describe mixed states. Here are some of them. It's going nowhere and everywhere at the same time. A mixed state is like being flushed down a blocked up toilet. There's no swimming out of the whirlpool of symptoms, the ups and downs, the in and out. Suicide tries to fix the problem by ripping out all the plumbing. It's like putting a ball bearing in a tube, sealing both ends, and then shaking it rapidly back and forth, so fast that you can't tell where it is at any one time. Depression on speed. You're danced and thrown around by an insane puppet master. An explosion. Grand opera. A war between heaven and hell inside your brain. Revved up melancholy. Grandiose despair. An absurd crucifixion. It's a chicken with its head cut off and put back on. I sometimes think of it as wild sex with the depression. Napalm. It's sitting silently, screaming. Suicide. Believe it or not, I really didn't want to die. When my psychiatrist called, I readily agreed to go into a mental hospital. There's a saying, suicide is a permanent solution to a temporary problem. That's the kind of thinking that was going through my head. I had to end this pain that I was in. I had to stop being a burden to others. Why do people do it then? Well, I can only speak for myself, but these were the factors. First, I wasn't trying to kill anyone else. Some armchair psychologists like to say that suicide is a way of killing not only yourself, but the person you're mad at. Now get this straight. The only person who was going to die, and I realized this, was me. Second, I'm not quite so sure it was entirely selfishness. I thought I was becoming a burden to my wife and that she shouldn't have to bear it. That's not selfishness, that's sacrifice. Sometimes suicide is a cry for help. I think that was the case when I attempted it. I was in despair. I wanted people to know how serious my state of mind was. I was in peril. They needed to know. It was definitely about stopping pain. Maybe that's why people call suicide selfishness. But when you're in pain, you're not only messing up your own life, you're messing up the lives of others around you. It's not, like Emil Durkheim described it, a rational act. It is true insanity. Now, I've had religious assholes who have never been there try to tell me that it is about selfishness. I have one loser on my Facebook page who just had to be right. Didn't care what I experienced, didn't care what was going on in my frame of mind. He knew what it was all about. God help him if he is in this dark spot, because he will hate himself more and be tempted to carry out his own execution. Sometimes you're on meds when you attempt suicide. Sometimes you're not. People take meds or alcohol or drugs to steel themselves so that they can carry through the suicide. But realize that people have been killing themselves long before psychiatry took center stage in the treatment of mental illness. Some cultures even respect those who commit suicide. Take Japan, for example. Over there, if you shame yourself and your family, you're expected to commit harikari. If your baseball team is losing, if your company is falling down, the right thing to do is to end your own life. Now, it happens here sometimes. I had a relative, an in-law actually, who broke his hip at the age of 84. He had long said that he didn't want to be a burden to others. So when they put him in the hospital, he refused to eat. Now, some people said this was a terrible tragedy, and others said, I take my hat off to him for having the courage to do it. My mother had a brain cancer that runs in our family, glioblastoma. It's a very painful way to go, and there is at this time no cure for it. They've had some progress with chemotherapy and reducing the size of the tumors, but this only lengthens your life by a few years at most. They can do brain surgery, but that will do more damage than it's worth. So my mother decided that she was going to let the disease take its natural course. She wasn't going to have extreme interventions. She wasn't going to try chemo. She wasn't going to have the surgery. She was just going to die. She didn't take any pills to hasten it along. She called this death with dignity. And when it comes my time, when I get that brain tumor, I hope that I can have that courage. I'm sick of hearing that suicides are going to hell. Now, the Catholic Church has come around. It used to be that you couldn't get buried in holy ground, that you had to be put on the outside of the cemetery. But now they realize that suicide is the product of a sick mind. They will give you a proper funeral. They will have the last rites at the gravesite. They realize, like you should realize, that it is mentally ill people who commit suicide. Now, for you unafflicted people, the big question: what can you do when someone you love, a friend or family member, is talking about suicide? First, don't try to second guess him. Many people have heard that suicide is a cry for help, or as it gets translated by the armchair psychologist out there, just a way of getting attention for themselves. They think that most people aren't going to go through with it, so they do nothing. Second, it's very important to get the suicidal person to a place, a mental hospital, an emergency room, where they can begin to receive treatment for the underlying mental illness. You have to throw apart all your prejudices against medicine because they are in desperate need. Third, please don't think of suicide as a civil right. It's a sign of sickness, and people who are sick do not make good decisions for themselves. Finally, if you have friends who are suffering from mental illness, there's a program that lets you certify yourself in mental health first aid. It's similar to Red Cross first aid, except it is specifically for psychiatric disorders. They will teach you about depression, they will teach you about bipolar disorder, what to do if a person is hallucinating, what to do if person is having a bad drug reaction. And most importantly, they will teach you what to do if a person is out to destroy himself. Get yourself certified. Learn the right things to do. Finally, for those of you considering suicide, remember that depression is a mental illness. And one of the characteristics of mental illness is that it distorts reality. You're not seeing things as they are. Pessimism and optimism are both responsible for making us think that the world is different from what it is. If you're having suicidal thoughts, see a psychiatrist. See a psychologist too, so you can apply either cognitive behavioral therapy or dialectical behavioral therapy, CBT or DBT. Both of these teach you to challenge those thoughts, to help you see who you are and how you think. I learned in the depths of my despair, where I believed that I was a bad, evil person. And there are plenty of people out there to confirm that. They're cruel. They're jerks. They like to do things like play with your mind. There was a man named Brandon Bayless who was seriously sick. He was typing in a chat room and drinking himself to death. What did the other people in the chat room do? They said, "Do more, Brandon, do more." You don't need friends like that. Find ones that care about you. Don't give up. It is worth your time to live, because when you kill yourself, you not only get rid of all the terrible feelings that come with depression, but you annihilate all chances for joy. And joy will come if you don't give